Hi, everyone. Welcome to See Arthritis. I'm Maya, and also a person living with rheumatoid arthritis. I'm joined today by Dr. Laëtitia Michou, who is a clinical scientist and associate professor at the CHU de Québec at the Université Laval. She led a workshop session at the CRA meeting on complex cases in osteoporosis. Thank you so much for being on our program today, Dr. Michou.
Thank you so much for your invitation. I'm so happy to discuss with you today.
So could you begin by telling us a little bit about yourself and how you're involved in rheumatology?
So as you mentioned, I'm a clinical scientist in rheumatology at CHU de Québec since 14 years now. And I'm involved in a research project on bone diseases, so Paget disease of bone and osteoporosis. I do also clinical rheumatology, so I see patients with arthritis and also with bone diseases. So it is my main activities at CHU de Québec, Université Laval.
Right. So I'm wondering if you can start by telling us what osteoporosis is and how it's different from something like osteoarthritis.
So osteoporosis is a silent disease that is due to the loss of calcium into bones that can give rise to some fractures for minor trauma. And it is very different from osteoarthritis. Osteoarthritis is due to degradation or degeneration of the cartilage in joint. So osteoporosis is really a bone disease. So the bone is more likely to have some fractures. So the fragility of bone is highly increased in the case of osteoporosis.
Right. And who's at risk for developing osteoporosis? Are there some people that have greater risk factors than others?
In fact, everybody can have osteoporosis, but there is some population more at risk of osteoporosis. Of people with arthritis, as you mentioned, are at higher risk of osteoporosis. It is an independent risk factor for osteoporosis, and people with arthritis may also take some cortisone that will increase the risk of fracture and osteoporosis. But in fact, men and women can have osteoporosis independently of arthritis. After the menopause, women are more likely to have osteoporosis. Up to 20% of women and 10% of men in Canada may have osteoporosis and fracture. So it is a very common disease.
Right. Is there anything that can be done to mitigate those risk factors if you are someone with arthritis or a woman after menopause?
Yes, there is some screening possibilities. So we can do some X-rays or measurement of the bone density to make a screening of the population to identify people at risk of fracture. But unfortunately, at least half of patients may have a normal screening, but are still at risk of fracture. So we also have some clinical risk factors, so such as lifestyle, some medications or treatment, hormonal treatment for cancer in women and men may be at risk of osteoporosis too.
Right. And last question about risk factors. I'm wondering if it's people with any form of arthritis who may develop osteoporosis, like any type of inflammatory arthritis or osteoarthritis, or is there a specific category that you're thinking of?
In fact, in the literature, people with rheumatoid arthritis are more at risk of osteoporosis. And among other kind of arthritis, any patient treated with glucocorticoid may be at higher risk of osteoporosis.
Okay.
So in osteoarthritis, usually the risk of osteoporosis is not increased.
Okay, thank you. So this is something that I believe you covered during your presentation at the CRA, which is why interdisciplinary collaboration in the management of osteoporosis is so important.
So the collaboration was one of the the objectives of the conference, the Canadian Rheumatology Association this year. And indeed, bone diseases are a typical example of collaboration in medicine, because bone diseases can be just follow up with rheumatologist or endocrinologist or nephrologist or internal medicine. So it is a kind of a group of diseases that is just at the cross of several specialties. So it is very interesting to have some discussion, because in bone diseases, you need a rheumatologist to assess fracture, you need an endocrinologist to assess hormone, you need a nephrologist to assess kidney. So it is a very multidisciplinary disease.
Right. And it seems like other rheumatic diseases are also the same way of having so many team members a part of.
Yes.
Mhm.
Nowadays, in medicine, everything is a teamwork. You cannot do anything alone now.
Definitely. And is there any other key messages from your presentation that you'd like to share with us?
So the key issues are just to remember that we need to do the screening, even though we may miss some patient with osteoporosis. We need to just be careful at not missing the time for screening. So it is at 65 years old for men and women, and earlier when there is some risk factor. And we also remember that we need, as a medicine doctor, to advise our patient about lifestyle. So do not drink too much alcohol, be careful about tobacco, do exercise, have some calcium in your food. So lifestyle is very important in osteoporosis.
Right, right. And if you were just speaking about how the screening of patients is quite important, if I, as a patient, let's say, if it's not something that my doctor has spoken about with me, would it be okay for me to advocate or to ask if maybe I should be screened at another point in my life?
So yes, and I think a lot of medicine doctor in the follow-up will miss to discuss this point with the patient, because they have so many things to discuss.
Mhm.
But with Osteoporosis Canada, which is an association for patients, you may find a lot of information, and a patient can ask to have a screening if it is indicated in the situation. Yes, for sure.
Okay, good to know. And you did cover this a little bit, but are there any other lifestyle tips that you can offer people, not only for preventing osteoporosis, but then actually those who are living with the disease?
So for those who are living with the disease, the same recommendation will apply. But in addition, we will ask them to be careful about falls. So there is some kind of exercise, such as Tai Chi, or some prevention of fall that can be offered by physiotherapists. So there is a lot of work to be done on that. And there is also advice for diet. So they need to have enough protein in their food to make sure that the muscle will be stronger enough. So it is another part of the disease. And there is a lot of possibilities for patients to find information on the internet on how to live with the disease. And it is more common in the public about information on the disease. So I'm happy about that.
Right. Not to put you on the spot here, but do you have any recommendations of those resources or websites that patients can go to?
They can go to the website of Osteoporosis Canada. So it is in French and in English, and it is well informed and reviewed by pairs. So it is really accurate information for all, even for doctor. So they do some guidelines for physician, and they do some a lot of activities for patients. So it is a very high, good level of resource for all.
Perfect. Well, we'll actually make sure to include then the link to Osteoporosis Canada beneath this interview. So if anybody wants to learn more, they can go there. Thanks for sharing that with us. I'm also wondering, is there any pharmacological treatments for osteoporosis?
Yeah, there are several step in the treatment. So we have some recommendation, as we mentioned. So we have also some supplementation of calcium and vitamin D. if requested. And at an higher level, we have some medications that can facilitate the accumulation of calcium into bone to make the bone stronger. So we have two categories of drugs. So some of them will decrease the so-called bone resorption, and we have another category which is a bone formation agent. So we can use one of or the other depending of the history of the patient and the risk or the relapsing of fractures. So
Great.
we have not so many drugs than in arthritis, but we have a couple of drugs. So
Well, thank you, Dr. Michou, so much for speaking to us today and providing all this great information. I think osteoporosis is something that that we often don't have the information about on this program in the past. So thank you very much.
It was my pleasure. Thank you so much for your interview today.